Hi, I'm Dr. Mike Knapp, and today I'm going to share a review article that was published in 2019 in the Journal of Integrative Medicine. It's on mindful eating. So this is the intersection between stress, digestion, and mindfulness. And this is fundamental to a traditional naturopathic approach in order to help people restore wellness. Stress has been correlated with functional digestive disorders like irritable bowel syndrome and functional dyspepsia, and that the severity of those symptoms relates to how much people access healthcare, and the severity dramatically decreases quality of life. This quality of life part is important because as a health concern goes on unresolved, there's times where it gets worse, and we didn't realize how much it was affecting us either until we're pushed to over the edge and it's really running our life, or we get a little bit of relief and we can see how much that we were really suffering because of that ongoing problem. She makes a special note that stress often has a negative connotation, but we need this stress. We need these responses to be able to navigate certain internal and external environments. The problem becomes with chronic stress. That can tear down our metabolic reserve because after the acute stress it's supposed to resolve, we're supposed to be able to change the environment or change our internal response to external circumstances so that it brings us back into a little bit more state of a balance. But without that, it prevents positive behavioral change, and stress is well known to contribute to most chronic disease and digestive issues. Mindfulness interventions have also been shown to decrease the burden of functional digestive disturbances. And she makes note that 90% of the serotonin in the body is made in the gut brain or the enteric nervous system. This is really important because so many people with a mood-based concern or anxiety or depression have been told they have a serotonin problem or are being put on medications that work on the serotonin pathway. 90% of the serotonin is made in the gut, and it's not just about mood. It also helps the digestive tract coordinate the muscular movement and the whole digestive process, as well as there's the gut-brain interaction. So the food that we're eating, the microbes that are present, and the environment around us are all going to be influencing this. If we're only focusing on trying to change brain chemistry by modulating serotonin theoretically in the brain with medications, we're missing a very large palette of the ability to really help people navigate beyond being stuck in these states. Now with chronic stress, there's going to be elevated stress hormone on an ongoing basis or elevated cortisol, and this has important effects on the digestive tract. For instance, increased intestinal permeability. You may be more familiar with this as leaky gut syndrome, or in traditional naturopathic terms, toxemia caused by improper breakdown of food and other waste products. Impaired absorption of micronutrients, abdominal pain, discomfort, local and systemic inflammation. So long-term stress, ongoing chronic stress is going to create ongoing inflammation, despite the fact that in the short term, stress is going to have an anti-inflammatory effect, but our body adapts to that and moves to an overall increased state of inflammation. This is really important because many people are aware that chronic inflammation is associated with almost every health condition that's chronic in nature. And many people know that they have pains, whether it's musculoskeletal, joint pains, or other symptoms in the body, they associate that with inflammation. Chronic stress is going to drive some of that inflammation. You can take all the turmeric that you want or all of the anti-inflammatories that you want, but if you're not aware of where some of the inflammation and stress is coming from, those things can only help a small bit. She makes, again, a special note that stress physiology is universal, but how individuals cope with stress influences health outcomes. This is where mindfulness enters. So let's go back up to this first diagram. This is a really elegant diagram that shows the interaction between these three things: stress, digestion, and mindfulness interventions. Let's start with stress. Under stress, it's going to alter the movement of the muscles moving food through the digestive tract. It's going to decrease blood flow to the digestive tract, which is going to impair the ability to get nutrients from your food. You're going to have that increased inflammation that we talked about, the decreased serotonin, the leaky gut, and then a whole bunch of changes in the nervous system. And then decreased stomach acid that's necessary in order to break down protein and digest our food properly. And then impaired nervous system, vagus nerve function. And the vagus nerve is a really important part of the rest and digest nervous system that really puts the brakes on the stress system. That brings us to a quick overview of two branches of the automatic nervous system or the autonomic nervous system. There is the sympathetic fight and flight branch of the nervous system, which many of us are familiar with, and this is really driven in a stress response. And then there's this parasympathetic rest and digest nervous system. This is the part of the nervous system that needs to be dominant when we're eating. So mindfulness-based interventions help to put the brakes on the stress response via the rest and digest branch of the nervous system. And mindfulness reduces and improves many of these potentially negative outcomes from ongoing stress, and then it stimulates, again via the parasympathetic nervous system, it stimulates the normal function of digestion, the normal muscular contraction called peristalsis, the normal healthy release of enzymes, digestive juices, and bile that help to break down proteins, help to absorb and emulsify fat, and it improves nutrient absorption. All of that mindfulness can help with. There's a second diagram that is really well organized that I want to finish and share with you, because this is how we get from stress eating to the mindful eating where our digestion is significantly improved. We're giving it the chance to operate in its optimal environment. And on the left-hand side, we have the concepts, and then in the middle, the known physiologic benefits associated. It's the normal physiology, and then some examples of how to work with that. So first is eating slowly. Chewing your food thoroughly aids in the breakdown of food. We need to mechanically crush the food first, and then it mixes with saliva and other digestive juices so that the chemical stage of digestion starts. And that's all. Many of those things are noted in the benefits section. You can read those. So chew the food, each mouthful 30 times. I'm serious. This was the first intervention that a holistic practitioner ever made for me. And it made such an impression on me, and it made a difference in my digestion, that a year later I was in Naturopathic Medical School to become a doctor. It's that important. So this is near and dear to my heart, mindful eating. Put the fork down between bites. This is going to cause you to eat more slowly, but it's also going to decrease the overall amount of food that's eaten. And then take deep breaths between bites. And that brings directly to the next concept, which is meditation. And meditation and breathing with those diaphragm muscles that connect with the bottom of the rib cage. Those things are one really good way to shift the nervous system toward that parasympathetic rest and digest. So you can listen to a guided meditation, you can do a little breath work before the meals, just anything that starts to create that environment for regular digestion to take place. Hunger and satiety. Satiety is the normal feeling of fullness. So she suggests even using a hunger scale as you sit down to eat. This could be really helpful in navigating how much food to put on the plate. If you're hungry 8 out of 10, maybe you need a full plate of food. But if you're hungry at, say, 3 or 4 out of 10, don't put a full plate of food together, because you might be more compelled to eat that. Maybe you only need a half a plate of food. So engaging your conscious awareness of eating and your hunger and eating more slowly and doing the meditation or the breathing, those things are going to bring you more in touch with these feelings of fullness before being overfull. Quick eating is going to lead to eating more food, and the quickness is going to create unpleasant overfullness that's going to linger, and that's going to impair digestion. Overfilling the stomach will burden your digestion. And now engage the senses. This is a really fun one. She doesn't mention cooking the food, but cooking your food is a really good place to start, because when you're cooking your food, you're smelling the food, you're seeing the food, you're touching the food. All of those things, the digestion starts in the brain. And so we want those digestive juices to already be stimulated as we sit down to eat, and the brain is preparing the body that food is coming. Some ways that you can do that is to suck on a lemon for the sourness. And I find that if I even just close my eyes and imagine the smell of a lemon, I can feel that tartness and prickling on my tongue, and already the saliva starts to increase. So this cephalic phase of digestion is very important. She has another trick. You can hold a little piece of dark chocolate in the mouth for the bitterness. And bitter things are going to stimulate digestion. Bitter greens, bitter herbs like dandelion root. These are very safe things that are going to stimulate the normal digestive process. And a common Western diet, bitterness is not a very big flavor in our overall palate. We have sweet and we have salt, but there may be some sour, but bitterness is definitely deficient. And foods that have bitterness and bitter herbs that stimulate digestion are all things that can be wholesome in food-based form. And then create the environment for healthy digestion to take place. Our digestive organs are emotionally sensitive organs. And anybody who has a functional digestive disturbance would probably say, duh, because they don't need research to tell them that when they're emotionally stressed, their heartburn is worse, or they get cramping, or any symptoms like that. It's just part of the way that they understand how the environment is going to affect them. So we want to foster the mindful eating environment, and part of that is sitting down to eat. If you're dining with other people, having conversation, have it be fun conversation, lightened, engaging conversation. Don't be talking about things that are going to be emotionally triggering. All of those are going to impair the digestion. Remove electronic devices from the room. Those are very stimulating. And then you might turn down the lights and light a candle. So you're getting less of that fluorescent light and a little bit of gentle candle light. Again, that's something that could nudge toward the parasympathetic rest and digest to improve your digestion. So this has been a review of mindful eating. I'm so excited that Christine Sherpak decided to publish this, because I think it's really helpful, and it's something in practicing traditional naturopathy that I talk about with every patient, because it's that important in helping to restore health, to understand the interaction between the stress, digestion, and mindfulness interventions that can help to shift that in a more positive, healthy way. I look forward to seeing you in the next video.